90% of people who responded had a wait list for adult clients, which was a range of 2 weeks to 6 months with a mean of 1 to 3 months. And that 92% of these people, and these are outpatient providers, had a wait list for child clients. So it was 92%. And that was also 1 to 3 months. People are waiting on wait lists to get services. These are people that have very difficult histories. They have trauma. They have children that are acting out. And they are waiting for up to 6 months for services. Outcomes improve when they focus on the child and the family. And that's very difficult to do when the child is not placed in the home. So what is the impact of not having access to outpatient mental health services? As I like to say, we either pay now or we pay later. This is a very complex issue, but we need to begin to understand how all of these behaviors, how all these services are related, and how all these outcomes are related. So according to NAMI, National Alliance for the Mentally Ill, excuse me, 2/3 of children and youth with mental health problems fail to receive the services they need. So what does that look like? What happens to these kids? As you know, kids act out when their behavioral issues are not met. When their emotional needs are not met. So there's behavior problems. When they go to school, they have academic failure if they make it to school. There's suspensions. There's substance use. There's depression, there's cutting. In fact, in terms of outcomes for education, NAMI states that over 1/3 of students with mental health conditions, ages 14 to 21 and older, who are served by special education actually drop out. They have the highest dropout rate of any disability group. And I'm sure Ingrid could speak to that. In a recent USA article, they estimate 350,000 mentally ill people are incarcerated in the United States. 10 times more mentally ill people who are actually in state-funded psychiatric beds. We have more mentally ill people in jail than we do. Excuse me, and there's also a greater likelihood, like I said, of poverty and children entering the juvenile justice system. Again, according to NAMI, 70% of youth in the juvenile justice system have at least one psychiatric disorder. Parents don't know how to help their children. What happens to these folks? Well, there's increased family and parental stress, which I think Lori and Beth could speak to very well. And sometimes they either try to control the child or they withdraw from their child. We've seen this a lot. When parents feel overwhelmed, it could become physical abuse. Withdraw could be considered neglect. 51As are filed for child maltreatment, and now DCF becomes involved. If it's really serious, which oftentimes if people don't get services, it doesn't get any better, it gets worse. And there's an out-of-home placement, which means further trauma for the child and the family. A lack of access to preventative care also means that we're overutilizing emergency services. 911, the emergency room, mobile crisis team. We're being reactive versus proactive is what the system has become. It's become a reactive system. And due to the inability to involve parents, or maybe the lack of resources to involve parents or families, while the child is in placement, the child is often returned into essentially the same environment in which they were removed, and the cycle starts all over again. Today's presenters are going to speak 2 to 3 minutes about their concerns about this issue and what they've seen happening to their clients and staff as a result of a lack of access to outpatient mental health services. And then during the last part of this event, we will begin to look at possible solutions, which are very complex and multi-pronged.